and she will be joining us virtually. Unfortunately, she was not able to be here today, but she is joining us virtually for the presentation.
Hi, everyone. Are you able to hear me? And my slides, are they available? Are you able to hear me? Okay, I see that the slides are there, but are you able to hear me? Okay. No? Hello? Hello?
I can hear you, Dr. Elmore.
Okay, I just wanted to make sure because I got a message that you couldn't hear me. Okay, perfect. So I hate that I can't be there with you today, but I'm excited to talk a little bit about the basics of breast cancer as we wrap up Breast Cancer Awareness Month. And so, as I'm sure that you guys have heard the adage, an ounce of prevention, a pound of cure. And for breast cancer, it's really more an ounce of early detection. And so, I'm going to talk to you a little bit today about um, talk to you a little bit today about an overview of breast cancer, discuss a little bit about early detection, talk about what happens if you have an abnormal mammogram, and then what happens if you're diagnosed with breast cancer. And so, what is breast cancer? And so, breast cancer really is an abnormal growth of atypical cells in the breast. It's the most common cancer in women. And as of this year, we actually know it's the leading cause of cancer death in Black women. And about 1 in 8 women will develop breast cancer in their lifetime. So let's talk a little bit about risk factors. So, a lot of the time we think, okay, you have to have a family history to have breast cancer, and that's not actually true. So, only about 5 to 10% of breast cancer happens in people that have a family history or is driven by genetics. The vast majority happens in people that don't have a family history. And so there are some risk factors you can't change. You can't change being female. You can't change the fact that as you age, your risk of breast cancer goes up. You can't change your family history. You can't change the time of your first period onset. But there are some what we call modifiable risk factors for breast cancer. We know that maintaining a healthy weight and diet helps decrease your risk of developing breast cancer. Furthermore, we also know that minimizing alcohol use, avoiding smoking, and participating in exercise can decrease your risk of breast cancer. And I think the most important thing to think, and a question I get all the time, is if you're diagnosed with breast cancer, is it your fault? And it's not your fault. And so, a common myth I hear is I feel great. I can't have cancer. But actually, most women diagnosed with breast cancer in the US don't have complaints. They don't actually even feel a lump in their breast. And it's also important to note that breast cancer is not one size fits all. It affects everyone at all ages, all races, and ethnicities. But we know that Black women are more likely to present with advanced stages of disease, more likely to die from breast cancer. That sounds dismal, but it's important to know that less patients are dying from breast cancer every year, and over 90% of people diagnosed with breast cancer will be alive in 10 years. So the bottom line is there's life beyond breast cancer. And so early detection really is critical. And so it starts at home. Over 75% of breast cancers are now diagnosed in very early stages and can be cured with routine mammograms and being aware of your own body. And so, one thing I always like to talk to people about is the importance of self breast exam. Nobody knows your body better than you do. And so, I tell people to do it at least once per month. I typically recommend doing it a couple times per month. And it really involves a couple different things. It's both looking at your breast and physical touch to examine the entirety of your breast and under your armpits. And what you're really looking for are atypical findings or that are different for you. Looking for a lump or a bump, any skin changes, you should alert your doctor if you find that. There are multiple ways to do it, multiple ways to examine yourself. There are some pictures here that show some of the techniques that you can use, but the key really is to examine the entire breast and all of in your lymph nodes under your armpit. Another critical thing is a clinical breast examination. And so, what that really is an exam by your medical provider. And so, that's typically completed by a primary care doctor or an OBGYN. And it's important to see these providers to maintain your overall health. Another really, really critical thing is you should have a risk assessment to determine your risk of breast cancer by the age of 25. And so, the other critical thing that has really been important for us detecting breast cancers early, where they're treatable, where we can spare the breast if at the time and where patients can be cured, is sticking to screening mammograms. I know many, many people got behind in COVID. That's a common thing that we've heard, but it's important to catch up now and go for your screening mammogram. Because as I mentioned, most breast cancer doesn't have any symptoms. And so it's really important to get a mammogram every year, starting at the age of 40. And so you may hear different things, different ages to start, different frequencies for how often you should get it. But every breast surgeon, every breast radiologist will recommend getting a mammogram starting at age 40 every year. The recommendations change a bit if you're high risk. So that's why that risk assessment by a medical provider is key. So if you have multiple family members with breast, ovarian, or prostate cancer, or you have a personal history of radiation to your chest, it's really, really important that you talk to your doctor because you may need to start at a younger age and you may need access to additional screening like an MRI. And so if you have an abnormal mammogram, what happens next? And so, fear is a big reason I've heard for that women not getting mammograms. And so I think it's important to understand what happens if you have an abnormal mammogram. And so after an abnormal mammogram, what happens is you get additional pictures with a mammogram and an ultrasound. There are a few outcomes. They'll tell you everything looks great. You can return to your usual screening. They'll tell you everything looks pretty good, but we want to keep an eye on it, so come back in 6 months. And then the final potential option is an area looks concerning, and we recommend a biopsy. And so, what's a biopsy? A biopsy is a sample of the breast cancer to get more information. Provides a diagnosis. It's not a treatment. And many people think, oh, if you, stick a needle into the cancer, that you're going to spread it. And that's not actually true. So exposing cancer to air, sampling that cancer with a needle, none of those things spread the breast cancer, okay? And so it's all done using numbing medication to keep it as to minimize any discomfort associated with it. And it really provides important information to determine how to treat that breast cancer, okay? And so what if it is cancer? So if it is cancer, there are a lot of treatment options. You'll have a team of doctors that include a breast surgical oncologist, someone like myself, to remove the cancer. a medical oncologist who determines if there are medications to decrease the risk of breast cancer coming back, and sometimes a radiation oncologist, which is a doctor that uses X ray beams to prevent the tumor in your breast from coming back. And so, a lot of the time, we hear about stage of breast cancer, and cancer stage really helps determine what treatment you need. We know now, because of mammograms, which should start at age 40 and happen every year, over 90% of breast cancers are treated when they're at a very early stage. And so, what that means is that they're small and confined to the breast and haven't spread anywhere else in the body. And so, there are a couple options for surgery. And I think the important thing to realize is now with early detection, most of the time, many, many women are eligible to spare their breast with surgery. And so the two options for breast cancer surgery are either removal of the cancer, leaving the breast intact, or removal of the entire breast. And because we're better at detecting things early, more often people are candidates to remove the cancer and leave the rest of the breast. And so, what about lymph nodes? Lymph nodes are a filtration system from the body, and they're the ones under the arm or the gateway from the breast to the rest of the body. So, most women diagnosed with breast cancer will need their lymph nodes checked, but don't need all of their lymph nodes removed. And some women will need chemotherapy, which kills cancer cells. It's a medication given in the IV and can sometimes come in pill form. It's typically used in women that have cancer in the lymph nodes, more often in younger women, and we have special tests to determine who needs chemotherapy. And then finally, radiation therapy or X-ray beams that you can't see and can't feel that kill microscopic or tiny, tiny, tiny cancer cells that we can't see and decrease the risk that the cancer will come back. And so the treatment doesn't typically hurt. People will have fatigue or will feel tired and can cause some skin burns, but is typically well tolerated. And lastly, there are pills that we can give for certain types of breast cancer to help starve those cancer cells and keep them from coming back. So the take-home points that I want you to remember today is that most breast cancer doesn't have symptoms. If you notice a change in your breast, make sure you seek help right away. And early detection really saves lives. So keep up with your mammogram every year. If you're behind, it's okay. Now is the time to catch up, and make sure you're getting a risk assessment by your provider. Bring your kids, tell your friends, make sure by age 25, everyone's getting assessed for their risk of breast cancer. For anyone out there listening that might have family members that have a history of breast, ovarian, prostate cancer, that's really, really important for you because you may need access to additional screening to detect, to monitor for development of breast cancer. And lastly, if you're worried about costs, we actually have programs to help with screening for free. So, and it's important to know that all breast cancer treatment is covered, including reconstruction by plastic surgeons. So, if there are any concerns or if anyone needs their mammogram and is worried about the costs, then we can always have Janelle put you in touch with my team and we'll help get that sorted. And here are a few resources to get more information about breast cancer. All right. So thank you for your time, and thanks. And I'm sorry I can't be there with you today. And I look forward to questions at the end.
Thank you, Dr. Elmore, for the information about what is breast cancer and the different treatment options and the other additional resources. So thank you for your time. So now we are going to invite our panelists to join us on stage. We have Sister Robin. Woo! Sister Robin, Sister Aisha, Sister Regina, and then we have two additional panelists that are tuned in online. We have Ms. Nedy, and then we have Mr. Juan. All right. Hi, ladies. And Miss Nedy, I know you're not here today in present, but hello to you too. So thank you all again for being here. We are excited to have this dialogue with you and so that you can inform us on your journey and how you overcame breast cancer. So the first part, easy part, an introduction. So please tell us your name, which I already said, but your name, your your church affiliation, and something relevant about you. Anyone could start first.
Okay, I'll get right to it. My name is Robin Blackwell. I go to church here at Southwest. Can you hear me? Yeah. Yes.
Yes.
And anything else?
Anything relevant about yourself? Whatever you want to share with us. Not the story,
I'm a
but
grandmother, mother, a wife, sister, aunt, and great niece over there, and just blessed, very blessed.
Thank you. We can have Miss Regina.
Hello. Can you hear me? No, there's no light.
You can press the button.
Good afternoon, everyone. My name is Regina Simpson, and I'm a member of West Church, and I am a certified nursing assistant, and I'm also a two-time cancer survivor.
Amen.
I am also the mother of five children now. I lost a son a year ago, 2 years ago, and also have 13 grandchildren and three great-grand. Proud of that. Yes.
Amen.
Hello, my name is Aisha Hunter. I'm the niece. This is my aunt Robin. I'm here with my mom and my daughter. Can you hear me? I'm here with my mom, who's on the front row, and my daughter, who's behind her, and her boyfriend, Jason. Um, I have two children that are grown. And I was, you can't hear me?
Yeah, take them out.
Just gotta speak
It's
louder.
better?
Yeah.
Okay. And I was diagnosed this year with breast cancer.
Okay, so next we are going to hear from Miss Nedy, who is tuning in from online. And everyone, we're sorry. You know, technology has a mind of its own and we can't control it, but thank you so much for being patient with us. We really do appreciate it. You may not be able to see her, but we should be able to hear her.
Can you hear me?
Yes, we can.
Oh, my name is Nedy Windham, and I am a 14-year breast cancer survivor. And I reside in Bloomington, Minnesota, and I attend Shiloh Missionary Baptist Church in St. Paul under Pastor Steve Daniels Jr. And I'm just blessed to be alive for 14 years after being diagnosed with breast cancer.
Amen. Thank you, Ms. Nedy. And next we have a video clip from Mr. Juan, who cannot be in person today. I'm going to give another 30 seconds to have Mr. Juan. Mr. Juan, introduction video. All right, so in the meantime, we're looking for his video. We are asking you to share your story with us, okay? So share your journey with battling cancer by answering the following questions. When were you diagnosed and at what stage? How did you feel when you first received the news? And then you go to the next one. So please share your story.
I did forget to mention that I'm almost 30 years cancer free. Um, and I give all the praise to the Lord because when I found my breast cancer, mine was a lump, and it was the size of a dime. And I went into denial, and I told myself that it's probably going to go away. So I waited a month, and then I noticed within a month's time it was the size of a quarter. And so I called my doctor, made an appointment, and before I had gone in, I actually had a mammogram. And so I was hoping that the mammogram would find it. I was still trying to process. Well, the mammogram missed it because it sent me a letter and said that I was fine. So when I got into my doctor's office, he had just been talking to me about my mammogram, and he said, "Oh yeah, I got the letter, and it said that you were good." So I didn't say anything because I wanted him to find it, which I know some people will think that's weird, but it's different when you're going through and it happens to you. There is no book on how to respond or what happens in your head. But for me, denial just worked. And when he found it, the first thing he said was, "I'm sending you back right now to get a new mammogram." And I said, "Well, they just did it." He said, "Your lump is not going to be picked up, but I'm going to purposely ask them to check the place where I found it."
Hello. Hello. Thank you for having me. My name is Juan Namnun. Before I begin, I want to send.
So I went back, and I say this being almost a 30-year survivor. Women, trust your own instinct. You have to have your own voice, and you have to speak up for yourself. When I went in, because I had had the mammogram just a couple of weeks before, the young lady wanted me to just sit and said she was going to schedule me for maybe 2 or 3 weeks later. The lady who was older sitting next to her said, "No, if something was found, it has to be done today." My doctor was so proactive that before he got the report, he had already called a surgeon. The surgeon, this was a Wednesday. The surgeon called me Thursday. I was on the operating table by Wednesday of the following week. The good news was that it had not spread, so I believe I was in stage 1. But the tumor was full of cancer. So not only did they remove the tumor, but they took extra cells. 2 years later, I developed 4 more tumors and had to go back. And they had only found the first 2. The day of my surgery, when they were mapping my breast, I don't know if they still map them, then the doctor looked at the mammogram picture, and that's when he discovered that the 2 he was looking at on the screen and the 2 that he had found were not the same 2. So I ended up with 4 new ones, and they were growing rapidly. So they went in, and he removed all of them. And then they got me the test because my cancer came back within 2 years. And that's when I was told that as I get older, my risk for breast cancer is extremely high. The interesting thing is that I'm almost 30 years in. So I praise the Lord because what people know now and what I went through almost 30 years ago is so different. But what I've learned is that we have to take control of our own health. We have to teach our children, our girls and our boys, and we have to be sure that they're paying attention to the changes in their bodies. Because if we don't, there is no reason for them to die. And there's no reason for young women and women, period, to die from breast cancer if you're doing the work. And I'm gonna tell you, the thing that I found out from my doctor was mammograms only pick up 20%. They only pick up 20%. The more dense your breast is, you could have a tumor in a place in your breast and it will never be detected by your mammogram. And that's why you have to do more than just have them looked at. You have to put your hands there and you have to do the work. It's the simplest thing that you can do, but it could save your life. And for me, as I said, I was blessed that my waiting didn't cost me my life, but that was my reaction to a place that I was petrified because I knew the moment I found it what it was. So do the work, ladies.
Thank you. You can- Before we ask Ms. Regina to share her story, we are going to play Mr. Juan's video, please.
Hello, thank you for having me. My name is Juan Namnun. Before I begin, I want to send a big thank you to Janelle Richards for inviting me to take part in this today. I'm very proud to have been involved with this. As I said, my name is Juan Namnun, and yes, I am a breast cancer warrior. I am a 23-year teaching veteran here in the city of Philadelphia. I have an amazing support cast of my family, and I am now in my second month of active battling breast cancer, but I do have a lot to say. And once again, thank you so much for having me. Hello, thank you for having me. My name is Juan Namnun. Before I begin, I want to send a
Thank you, Mr.
big
Juan.
thank
So
you
we
to
are going
Janelle
to hear from him
Richards
again
for
throughout the
inviting me to
program.
take part in this today. I'm very
And maybe when you walked in, you thought, why do we have blue balloons? So now you know the blue is to represent the males that also do have breast cancer. Thank you, Mr. Juan. So now, Ms. Regina, we'll ask you to share your story.
Yes.
When were you diagnosed and at what stage? And how did you feel when you first received the news?
Okay, so first I just want to thank you for inviting me here to be on your panel. And I wrote some things down because my memory is somewhat suspect. But anyway, I was diagnosed in 2009, a week before my birthday. I was planning a trip with some of my coworkers, and we were going to go on an all exclusive. And I decided, and I mentioned earlier that I am a certified nursing assistant. And the reason why I mentioned that was because I was working 3 jobs. I was working a full time, a part time, and every other weekend. And so I was very busy, and children were coming up and everything. And I had not had a mammogram in 10 years. And so I decided that before I go on the trip that I would treat myself to a mammogram. And upon doing so, there was something on the screen that was shaded. Am I too loud?
No, you're perfect.
Okay. There was a shaded area there, and when I did the mammogram, and they wanted to look further. And upon looking further, they found out that I was a stage 1 breast cancer. Now, when you ask the question, how did I feel when I received the news? I had a twofold feeling. I was sad, of course, because I didn't want to, go through whatever I was about to go through. But I was strangely grateful. I was very grateful. I was grateful to the Lord for several reasons, because I hadn't looked and it could have been a lot worse. I was grateful that it was a stage 1, and it could have, could have been stage 4 or something. So, in my negligence of raising my children and working and trying to provide, I neglected my health, and by doing so, God was still merciful in the sense that it was only a stage 1. The other reason why I was grateful is because at that time, my relationship with the Lord was suspect, so to speak. It was just, I was so busy running all the time, trying to deal with the children. My daughter was about to enter into Oakwood University, and I was just busy, 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 and really didn't have a lot of time that I was spending. And so everything stopped. When I was diagnosed, everything stopped. And in stopping, it got my attention. And so I began to draw closer to the Lord and my walk with Him. And so, in one sense, I used to, after being diagnosed, I used to come to the church and say that it was a blessing. I said me having cancer was a blessing because I was going in the wrong direction and God got my attention. Not to say that God gives us these things, but He allows certain things to happen for our, for our benefit in a strange way. Of course, we know the enemy has done this, but God used it for His glory. And so I think that answers 2 of your questions.
Thank you for sharing that, Ms. Regina.
You're
Thank
welcome.
you. The next is Aisha. You share your story.
I was diagnosed this year, 4 days after my birthday. And me and Robin actually share a birthday. And I actually had started maybe about a year ago, deciding to take my health really serious and losing weight. And I just wanted to. So I was caught up on all my doctor's appointments. And the mammogram was just part of just my annual thing. I went for my physical in September. And I did not go immediately because mammograms are uncomfortable. So I really just procrastinated. And normally when I do go to get mammograms, I always get a letter that says they want to do another one because I have like cysts and, a lot of things just going on. And I'm used to that. So, but they normally turn out to be nothing. They'll say, just come back at your next. So I just didn't want to deal with it. So I went in September. And in March, all of my doctors were through Johns Hopkins in Maryland. And they called to schedule an appointment. And they called and she said, "Hey, I have an appointment today." I said, "Oh, okay, I can't come today." And she said, "I have something tomorrow." And it was really fast. And she was very friendly. We had this really nice conversation. And she was like, we talked about COVID and she was working home. And I always remember that because we just had, and she said, "This has been a really good conversation," because it was just matter of fact. I didn't give it much thought. And I went in, I did my mammogram, and it was uncomfortable as I knew that it would be. And then a couple weeks later, I received a letter. And the letter said, "We found something." I can't remember exactly how the wording was. Um, and it was this little voice, and it was like, this word just seems a little different. But I was like, maybe I'm being, maybe I'm just being anxious. Maybe I'm overreacting because I'd kind of become concerned. I had blood pressure. I got COVID around Christmas. So I'd had little health things that I really hadn't experienced. And overall, I don't really get sick. So I was kind of just on alert about things. And I was like, well, maybe I'm just being a little paranoid. It's probably nothing. Let me just go. So they scheduled, this was in March, and I went at the beginning of April. And I went to the appointment. I didn't even take anyone with me. That's how routine. And I went in, and the technician, I just remember they had me come in, and they were going over, and I could feel this particular part where she was taking the machine and going over, and I could feel something. I didn't feel any lumps prior to that. And she just kept running over it. And I'm laying there and I started saying, okay, God, is this in my mind? Am I being paranoid? But this feels different than my normal mammograms. And this feels different. And she was just looking, and she just kept running over this area. She just kept running over this area. So, I didn't say much. And then I felt like I was laying there a little longer than normal. So I said, okay. But again, I was talking to myself to outtalk what my instincts were telling me. So then she left out, and she came back, and it was 3 more people with her, including the doctor. Now, I've gone to a lot of regular appointments. I've never seen They always say I'm going to go take it and let them see it, and then they'll come back and say, okay, everything is good, make your appointment, come back for annual. But the doctor actually came in, and another technician came in. So they all came in, I'm sitting there. So I was feeling a little something, but again, and they're not really talking to me. And so I kind of jokingly said, should I be concerned? Now, I've done that before. Normally they'll say, oh, no, it's nothing. They said, oh, we want a better picture. But they did not answer whether I should be concerned. So I said, okay. And then they were talking amongst themselves, and the other technician came over and she put the thing on it in that same spot. I could feel it, the same spot. And she said, oh, yeah, I would have done the same thing. But they're talking to each other. So the doctor never addresses me while she's in there. And then she tells them to tell me to get dressed, and she's going to get a letter and come back. So the second technician that came and she says to me, I know you're freaking out. She said, get dressed, and the doctor's going to come back and talk to you. Which, again, these are not reassuring words. I'm like, okay, it's probably still nothing. They're probably just seeing something. And I'm giving myself this pep talk. So the doctor comes back and she has this letter. And I've worked in the medical field. And when she came and she had someone with her. And I said, I know this routine that they do when they bring someone in because they don't know how you're going to respond. And she had this letter in her hand. And she's talking to me. She says, I believe the word she kept using was suspicious. We saw something suspicious. And automatically I went into, okay. But I think I wasn't surprised. She said, do you have any questions? And I think I said, no. She said, well, we saw something suspicious and I'm going to recommend you get a biopsy. And she's talking and she's saying, this is where it kind of got a little blurry. And she's saying, well, it's different parts. You may need to break it up. But I'm hearing all these terms. But again, I'm just like, but she keeps saying suspicious. So then I said, well, I do have a question. What do you mean by suspicious? Okay. When you say, she said, well, we have a concern. I said, well, what does that mean? I kept asking her, tell me, what does that mean? And she says to me, it should look like this, but it looks like this. And she said, well, let me show you. She pulls it up on the screen and she says, when you do this, this should be black. She said, but this with yours. And I can see all this cloudy something in the picture. And she said, I said, what does that mean? She said, it looks like cancer. And what it felt like was that my head went underwater. And I don't remember much. It just went, and I remember just, okay. And I think I cut her off because she had this look on her face, and I didn't ask any more questions. And I took the letter, and I was trying to find my way out of the room to my car, to the parking lot. And I got in the car, and I started screaming and crying. And I just was in shock. I was already in survival, if that makes sense. So when you're already in survival, so even now when someone says you're a survivor, it still doesn't click because I was still surviving from what I was surviving from before. I had lost my job. I had, it was so many changes that I was in the process. This is where part of, I'm going to get myself together. I'm going to get my health together. So I was already in survival. And then to get this, but I was already in survival. So it didn't make sense. It was just like, it just didn't make sense. And I kept saying, I believe I called my mom, and it's kind of a blur. And I think I was yelling on the phone. I think that day when I called, I believe I was just screaming because the way it hit me, it was in waves of, but I had decided to get myself together, so why now? Why now? Why? And cancer does not connect to my name and who I am. So that it doesn't look right. It doesn't sound right. When people say it to me, they're talking about somebody else. They're not talking about me. So how did I feel? I got myself together. I cried and I screamed. And I don't scream, but that day I screamed. It felt like it came from the pits of me. And I finally got myself together and I went home. And I got into bed. And I stayed there for like a week. And I called to make an appointment. And this is, some of the stuff that sometimes is funny to me because I got my mammogram quickly. I got the letter. And then they said, okay, you may have cancer. And then they said, okay, we're gonna come back in the biopsy for about 6 weeks. And I was supposed to sit there and just wait, not knowing if it was cancer, what it was. And I couldn't function. I couldn't get out of bed. I just couldn't. I wished that I could say that I was stronger. I wish that I had responded differently. And it wasn't even afraid of death. It was just one more thing. Like one more thing. That's the way it felt. But my sister came and they saw how I was, and she called. I do not know what she said, but they got my appointment because I had my first biopsy the 15th of April. And I passed out. I don't even pass out, but I passed out. And I think it was all like worked up in my head. And I don't like needles. So this whole experience, I hate needles. So imagine that you're sitting, and I think that may have been part of, she described everything she was going to do. And then they called, and I had my second biopsy. I had the one with the mammogram, I had the one with the ultrasound the following Friday. And that was right before my birthday. My birthday was, what was it, Saturday? I had it on 2 Fridays. And they called me. So I had the one on the 15th. And they said, okay, you should have results in about 3 or 4 days. It didn't come. I didn't get results. I kept checking. You have a thing where you can log into my chart. I kept checking, and no results. I was like, okay. And then I had my other biopsy. Those results came Monday. I had that on Friday, but it was the following, and it was benign. So the way my thinking was that they were testing, in my mind, I believe, I pictured one lump, and they were doing different tests on this one lump. So if one was benign, in my mind, I believe everything was benign. So we were excited, and I told my mom, and she's like, okay, thank you, Jesus. And he came through and he answered our prayers, but it was something that felt like that wasn't the end. And it was just something because I still did not have the results from the first biopsy. So I was like, okay, I was still like, let me be optimistic that, I don't think God would give me cancer, because he's given me so much and I've been through so many things. So, he wouldn't give me cancer. That's the way I thought. And my doctor called me Wednesday morning and she said, can you talk? I said, yeah. She said, what did you see the test results? I said, I did. I saw it was 7-9. She said, well, yes. She said, but your other test results came back. I said, okay. She said, well, it did come back that you have breast cancer. And when I hear these things, it still feels like I'm having these out of body experiences, because this is not a story that I saw. I am the one that maybe will visit someone. I will give support to someone that has breast cancer. I will bring the food. I will, but I am not the one that gets sick. So when she's talking and she said, yeah, so, and then she, you don't hear a lot after that. She's talking surgeons and these appointments and oncologists and all these words that do not sound like what fits into my life. So I said, okay. And at that point, she didn't know what stage it was. So I called my family. We have a group chat, and I put them on Zoom. Or no, what would he do? A FaceTime message. And I said, hey, the doctor just called, and I just kind of let them know. And I didn't know much else. And then I went back to work, and I just kept working, which I found was going to be my help to try to maintain normal as much as possible. So, yeah.
Wow. I want to say thank you for sharing that story and being transparent with your emotion, your raw emotion, like screaming and everything. So, and to be very transparent with everything. So thank you. We're going to come back and ask more questions, but thank you for sharing that very intimate moment with us. Thank you. Next, we're going to have Miss Nedy on the screen, and she is going to share her story with us.
Hi, can everyone hear me?
Yes, we can hear you.
Okay. Yeah, I was diagnosed in December of 2008. So I was 51 years old, and it was a routine mammogram. It seemed like when the doctor was talking, I said, she's telling my entire story, because I had no family history. I had been having mammograms since I was 30. And at that point, after 40, I'd been having them every year. So I had about 15 mammograms at that point, and they were all clear. So there was nothing I just expected 2008 to be just like all of the previous years, all of the previous 15 good mammograms that I had. And then that one was, there was more words on that form letter, and they referred me to the breast center for more testing. And at that time, 3D mammograms were not like the norm like they are now. They were just on film, and they picked up a spot. And then when I went in the room where the 3D mammogram was, I don't think about it today because, you know, now they're, like I said, they're the norm. But back then it just seemed like this huge machine that was hooked up to a computer, and you could see the spot that they were looking at right there on the computer screen. And then they took me down the hall for the ultrasound, which confirmed the spot that they saw on the mammogram. And that told them that there was something there, it wasn't just a shadow. And then the next day, they did the core needle biopsy that the doctor mentioned. And that was a Friday. So you can imagine over the weekend, you know, you're just trying to continue on with things. Again, it was December, about mid-December, so it was near the holidays. I'm originally from Detroit. I live in Minnesota, so I was getting ready to go back to Michigan in just a couple weeks. So I was just trying to put that out of my mind and get ready to leave. And then on Monday, I get a call from a patient navigator at Fairview Southdale Hospital. And I knew right away, something just kind of told me that it was cancer, because maybe because she asked me, are you driving? Because she called me on my cell phone. And I said, no, I'm in my office. So I closed my office door. And then she told me that I had breast cancer. And I don't know what it was in me, because something, I think it's from my mom. She was always kind of the organizer and the person to just kind of pick up when you get news, and it's like, okay, instead of, you know, dwelling on it, it's like, okay, what am I going to do next? And I think that's where I got that from. And then it's like, okay. And I remember getting a legal pad out, and I turned the page over to a clean page, and she just gave me this list of everything I had to do tomorrow. And that told me that they were fast tracking this, because it was a phone call. And then the next day I met with an oncologist, a radiologist, a surgeon. I had PET CT, I had a breast MRI. I mean, I had a whole day of tests and doctors. And I did have stage 3 breast cancer. And that's why I always, like the doctor said, wherever I go, I always tell people about mammograms, because if I had decided not to have that 15th mammogram and said, you know, 15 years, I've been good. Who knows what would have happened if I had waited another year to have a mammogram. And they found several tumors in my right breast, and they were graded at stage 3. So I do feel blessed that we did catch it early. I had a lumpectomy in my right breast. I had rounds of chemo and radiation and medication, all lasting for about 1.5 years. And I know what got me through all of that was my faith, my family. I have some cousins that live in Minnesota, but most of my family are back in Michigan. My mom was not alive, so I didn't have her to lean on, but I did have my church family, and my family and my friends. And then I'm also a member of the African American Breast Cancer Alliance that was born here in Minneapolis, Minnesota, by a group of African American women, now almost 30 years ago, who did not have a support group at that time. And so they went to other support groups, and they said, you know, they're not talking about anything that affects us personally. And so they started that organization. And so I've been blessed to have that family as well as my church family and all. And I think for me, I felt like, sort of like what the other sister was saying, is this a test I think, we have tests along the way for our victories. And I felt like, when my mom passed 4 years prior, I was executor of her will and all. And I never felt like I got a chance to grieve her for about a year, because it was going back and forth from here to Michigan, taking care of, Social Security and planning for, everything, and taking care of all of the business side of it. I don't think anybody stopped to think, well, what about, Nedy's grieving too? It was just that, okay, take care of all this business. And that's kind of how I felt when I was going through this, is that, I was working at the time, but I did feel blessed that I was able to be off work for a year. I worked for the University of Minnesota. So I was blessed with good health insurance. I was blessed with all of the family and friends that I could. So, whenever you start to have those moments where you would kind of feel sad or down, or why me, then I have to think about all the women who didn't have that support, who had to work because they didn't have the jobs that they could be off work for a year and get full pay and pay for their insurance, it would pay for all of this. So through it all, I know that I feel that I've been put here I went through this in order to share my story, to help other women, to be able to know that there is survivorship, there's thriving, and there's surviving after cancer, and there is life after cancer and during it. Because I always tell anybody, if you can survive chemo, you can survive anything. So that's my story.
Go through the core biopsy, the chemo, and the whole 9 yards. And my children are in the prayers of the saints is what got me through it. But in nursing, you wouldn't think that I would have missed a mammogram, but I did, because I was so busy and time just went like that. And when I looked up, it was 10 years. But I want to say that God took me through it. And then, I managed to get through it. It was a horrible experience, the chemo. And I don't think it really hit me until I got to the fifth one. I had 6 treatments to go through. But when I got to the 5th treatment, I thought I was going to die. And then is when I really called out to the Lord and said, I can't take much more. And it was all that I could do to go back to get the last treatment. My husband talked to me. My children begged me, Mom, go back and get there. And I said, if this is, I'm not going to do it, because this is like suicide. I mean, this is ridiculous. It's like you're giving me poison and it's killing me. And the pain from the 5th treatment was so horrific that I said, there is no way that I willingly will go in and have that 6th treatment. But God, and the prayers. And I want to say 10 years passed, 11 years. That I was a week away from my 50th birthday when I was diagnosed. And 11 years passed when I was diagnosed again with cancer. So if you see my hands, I'm treating now as we speak. And at that time, when I was diagnosed, I said to my children, I called them together and I said, I will not go through this again. So whatever God will is what I will do, but I will not send myself through this treatment again. And my son, my firstborn son, who at that time was in his 40s, said to me, Mom, don't say that. This was just 2 years ago. And I said, son, I've had enough. I'm not going to go through this again. If this is what God will, I'm going to, but I'm not going to do this to myself again. And 6 months after I said that to him, I'm not even 6 months, I think it was maybe 3 months. It was during the holiday time. And the doctor said to me, we won't start treatment now. We'll start it after the holidays. Go through the holidays. And that didn't give me a good feeling because I thought, what is he saying? Is it that bad that I'm not, that I shouldn't rush to address it? But he said at this point it was in three places: my colon, my liver, and possibly my lungs. And so he said, enjoy your family, and and go, and we'll deal with it after the holidays. And so 4 months passed, 3 months passed, and I had talked with my son, and I said, I'm not going to take the treatment, but at the persuasion of my husband and the rest of my children, I said, well, whatever God's will is what I will do. I'll put it to you like that. That's the best I can tell you. And so 4 months, 3 months passed, and I got a call uh, that my son had took his life, my firstborn child. And so when he took his life, and that's a whole nother story. I won't go through it. I'm saying this to say that even as cancer survivors, life still goes on while we're going through this. Things still happening. Things are, you still have to work. You still have to meet your needs, and still things are happening. And when my son took his life, and he was depressed, we found out from brain tumor that he had removed several years prior to that, and he was very depressed, and we didn't know it, and so he took his life, and that spent me out of control. And I said to myself, I would take the treatment, just thinking about his request to me. So I took the treatment. I had three surgeries, part of my liver, part of my colon, biopsies, chemo, radiation, and the whole bit. And now I'm down to just taking chemo pills. And so I'm cancer free again, and I owe it all to God. And so when I was asked to come, I said, when I was diagnosed this second time, I before when the doctor called me to say, we want to see you, it's like I instantly knew that something was wrong. And so I asked the Lord this time. I said, Lord, I won't make it. You have to give me something to hold on to. And you have to give me something to hold on to. I can't do it again. So I opened my Bible, and when I opened the Bible, it came to Psalms 118. And the Lord pointed my direction to these three verses. I wrote these three verses down. This is 2 years now that I've been going through this cancer, and I wrote these verses down. And it says in Psalms 118, verses 16 to 19, it says, no, 17 to 19, it says, I shall not die, but live and declare the works of the Lord. The Lord have chastened me sore, but he have not given me over unto death. Open to me the gates of righteousness, and I will go into them, and I will praise the Lord. I praised the Lord through it all. I praised him in the good times and the bad. I kept this scripture and I wrote it down, and then I went to the doctor. And I can't tell you how this changed everything, this scripture for me, because I was not I was not I was not sad. I just knew that I had a fight, that God was going to take me, help me go through this fight. I strapped up, my boots, and I just got into the word of God, and I counted it all joy. And I said, I will not shift, because when you're going through a storm, you must have your anchor in place. You must know who you believe. You must know who you serve. You must know that God has you in his plans. And I know the work that he has for me, and that is of good welfare and not of evil. And so I set my mind on that. And that's the only thing that kept me through this time of going through cancer again. So I want to encourage anyone to two things that don't neglect having a mammogram. I was blessed in that 10 years I hadn't had one, and it was only a stage 1. And don't, the other thing is, know that God has a purpose and a plan for your life, and that He will finish what He has started in you, and that to trust Him, and life storms will come, but hold on to God's unchanging hand. He is the one that will take us, and we can do it joyously, even in the worst of times. If I had not known the Lord when my son took his life, and the fact that I was diagnosed with cancer, I would have told him to bury me right beside him. That's how horrific it was. But I had no time to go through. I had to know who I believe, know what I believe in, and hold on to the Lord.
Amen. Thank you, Sister Regina, for sharing that and just reminding us to continue, no matter what we're going through, to continue trusting in God, because like you said, He has a plan for us. So thank you for that reminder and sharing the scripture too. Thank you. And because she mentioned what she mentioned, we are going to hold off on Mr. Juan video. We are going to ask Ms. Aisha and then Sister Robin about what gave them the strength during their experience. And Ms. Nedy, well, Ms. Nedy did hers, but if Ms. Nedy want to add more to it, thank you. Either way.
Um, as I said, I spent those first 4 weeks in denial. And for me, I knew it was there, but as long as I didn't give it time, my brain was giving me one thing, my body was speaking another. It wasn't until my doctor, he had been searching like doctors do. And then when he put his hand on it, because I was waiting for him to find it, as if he was going to give me, I don't know, it was kind of like if he found it, then it made it real. Because for me, it still wasn't real. And I knew the importance because I knew it had gotten bigger. But I got stuck. I couldn't do the screaming. I couldn't do the hollering and I couldn't speak to it because I believed in that moment that it just wasn't. And the interesting thing was I was in my middle 40s, and I had started the mammograms and had done well. And as I said, I was in the shower and there it was. And I remember standing there for a period of time, and I kept touching it and squeezing and moving and running my hand over and over. And then when I got out, it was as if I thought the water had something to do with it, because I dried off and I tried it again. But I just kept in my head thinking, it's not real. And I didn't receive it, like it was going to just go away. I don't know why. But ultimately, when the doctor put his hand on it and his eyes got big, then it validated that I had a problem. And what kept me was that I had young children, and I just focused on them because I thought if I kept focusing on the cancer, it would defeat me. And I know that doesn't make sense, but that was where I was, that it would defeat me. But I didn't want to empower it. And so I kept with my normal life, I kept moving. And even when everything moved very quickly for me back then, because the doctor had already moved on and he already anticipated that it was going to be cancer. So when I was on the table waiting for surgery, and he's talking and telling me what they're going to do, there was still this place in my head that it wasn't real. I know that's crazy, but it wasn't real. When I went back for my consultation for them to look at how I was doing, and he said two things. Do you want the good news or do you want the bad news first? And then inside, like my niece said, she kind of went, there was this thing like everything just dropped to the floor because there was bad news. And if he had said everything is good, I would have been okay. But in my brain, I was like, this is not happening to me. I'm a mother. I have small children. I've got a lifetime of things to do. Nobody I know has breast cancer. So I'm talking in my head, and then he just takes out all this paperwork and the oncology report, and he starts to talk. And then when he says the cancer was inside the tumor, I think there was something that had my brain just kind of stopped functioning because I heard cancer. And then he said, that's the bad news. He said, but the good news is that we got it out before it had time to spread. And so I think I had stopped breathing for the bad news. And then there was a slow exhale. But then he said, you're going to notice a difference when the swelling goes down because we took out a lot of tissue, a lot. And he wasn't kidding. They took a lot out. But it was this thing where I just didn't want to accept it. As I said, I was with the dinosaur days. Everybody else is a lot more up on the medicine. It's a lot different than my time. But he had said because they had removed so much of the tissue that they thought it had got it. As I said, it came back. But at that time, they were very sure that they had taken a large part of my innards out, not just the tumor itself. So they took a lot of that out. So he said I would notice the difference, but I definitely, it took me, believe this or not, it took me a couple of years. It was the second time where it was different. The first time I lived in this fantasy world, the second time it was not the same because I refused to accept that that's what was happening. Because I couldn't believe that it came back. I really couldn't believe, because my thing was, it was just 2 years ago. I'd done so well. How and why? And that was where it was a lot harder the second time.
Thank you, Sister Robin, for sharing that too. Thank you. And the same question for you. What gave you the strength during your situation?
I have to agree with her as far as being in denial. And quite honestly, I'm still processing. So the reality of, I think through every stage, I have seen miracles. I've experienced it. God has done some things in my life that are so amazing. So I consider myself amazing. So I said, I know what's going to happen. I'm going to go. They're going to put through all, they're going to think that I have it. All the way up to my surgery, I believed that they were going to hook me up and say, we can't find it. You know those stories. We can't find it. That was going to be my testimony. I went. I didn't have to get surgery. I didn't have cancer. We prayed about it, and it's gone. But it was not. I went, did a different test. I had a lot of ups and downs. They did a genetic test, and I had to wait to see if I was prone to more cancer because my options were that they could remove the breast. When I went to meet with the surgeon, he told me that, and all of my doctors were really good, which I think also helped a lot. He said, you have a little bit of cancer, but it's kind of big. So I said, okay. He said, well, we can do this. He said, we can cut it out, remove it, and we can fix both breasts. All your friends will be jealous. That's what he told me. He said, they'll be jealous of you. It'll be new. It'll look wonderful. So I said, well, that sounds, kind of good, right? So, which is actually, and one of the things that when I hear stories of those before, but I realized what they used to do to us is basically they kind of cut us up and just sent us home and say, you're lucky to be alive. Like that's a lot of the stories that I hear. They would just chop you up, send you home disfigured, and just say, hey, just be glad you don't have cancer anymore. where now it's more of this quality of life, how you feel. Um, I sat and I took my clothes off one day and I looked in the mirror and I looked at my breast and I said, "You betrayed me." That's how I felt. We were in this together. You gave no signs, and all of a sudden, I felt like it was just this sick part of my body, according to what they were telling me. But probably the denial probably did help a lot of my strength, honestly, because if you don't believe that it's really true, I mean, what can you really be upset about? Also, God had done so many things. So it never occurred to me to be fearful of death or those type of things. The things I thought about, and my mother thinks something wrong every time I tell her this, but I'm very specific sometimes in what I ask. I ask God to give me beautiful children. He gave me beautiful children. I put them in private school. And I said, I need them to graduate with no bill. And he gave me money when I didn't have it. I lost a job. So I'd seen so many miracles. He paid rent when I didn't have money. He brought me through loss and death and so many different things. So the thought that he wouldn't bring me through now, what it was going to look like was concerning. Well, what is this going to look like? Am I going to get real sick? Will I look really bad? Will I have to get chemo? Are they going to cut me up? But one of the things I'd asked them was, don't let me die before I lose weight. So, yes, probably sound vain, but I'm very specific in what I ask. I ask you not to let me die fat because I do not want that funeral where they're struggling to carry my casket. These are the things that I thought about.
Hey, it is, right?
I so when people ask, these, and some, even my daughter, sometimes she didn't. I said, this is how I think. But I don't know, when people call and they say, I'm praying for you. And honestly, sometimes when they would call and I would say, he knows. He knows. Please don't go to him every day about me. And they would say, what do you need? And I would say, you know what? I really could use my room being clean. So when people ask you, when you ask someone, what do they need? What do they need? If they say, hey, I need you to pick this up from the pharmacy, that is what we need. Because sometimes people will call and they have in their mind how it should look for you. And they already have it made up how you should feel, what you should think. And I would even have people call and say, oh, you're in a good mood. I said, well, why shouldn't I be? Should I be sad? I don't understand. Is there some type of rules to how you should process this? Should it look the same for everybody? And everyone wants to share stories of people in their family that have had it and what their experience was. And a lot of them were people that died. That is not inspirational, just so you know, okay? To tell me about the aunt that died from it or the cousin that died from it. So I know that people mean well. Yeah. They do. They don't know what to do for you. And all of a sudden I realized how many foolish things I've said to people when they were sick. Because the thing about this club is to get in it, you have to go through it. And you really, it's no way I could have known what it was going to feel like. And so some clubs are just like that. There is no right thing to say. Some days I didn't want to talk to anybody. Some days I didn't want to talk about cancer. Some days I just wanted to get something to eat or just rest. Even going through treatment sometimes. It's but so many ways you can describe how you feel. And sometimes you don't feel anything. You're just going through it. But my daughter was good. My mother was good. My family was good. And one of the things about when you get sick, if you want to know who's in your circle and what they're made of and who is for you, get sick. Because those that you couldn't have told me they wouldn't be there were not there. But those that I wouldn't have even thought, they were there. That's when you really know what everyone is made of, is when you're in a place where you really have to rely on someone else. Because coming from surgery, I've never had surgery. So all of a sudden you have surgery. You want to push yourself. That's what you want, like a cold. You just want to, it can't. I had to rely on my daughter to help me bathe, to change dressings. You're looking at this figment and these stitches, and it's things you just cannot do, and you get tired. Because you can look okay even now, and all of a sudden you are so tired. And guess what? People will get tired of hearing about it after a while, even though you're still going through it. I rung the bell for my last treatment last Friday. Thank you. But the reality is my body's still recovering. I put clothes on it, you can't see it, but when I take it off, my body looks in a way that's never looked before. I have skin peeling and burns, and this is the first time after all the treatment is done, and they're calling me a survivor and what you've been through and how strong you are. And now I look sick. In my mind, this is the first time I've actually looked sick or cancerous. I mean, skin that has been burned, it has a smell to it. You have this soreness sometimes and this pain that just shoots out as you heal sometimes that no one knows. And they tell you that you look good, but sometimes it's so many, you may deal with anxiety and some depression. And some days you are one, you're in prayer and you are thankful. And then some days you cannot get out of bed. And it's just no order to it. So I'm still getting strength. I am still discovering who this person is. And I don't like to say I have cancer. I like to say I was diagnosed with it. Because I don't even want to accept that label. Even being a survivor, well, what am I surviving? And some of these things, what am I surviving from? What did I survive? So those that aren't here, are they not survivors? Who decides who's a survivor? Who decides who's strong? Who decides whose story is better? Who decides that you're weak for this or strong for this? What makes you a hero? So I'm still processing. So I hope that answers the question.
No, it's more than enough. And thank you so much for that. And we actually have a photo of you ringing the bell. So let's see if we can have it on the stage. I mean, on the camera. Let's see. All right, so there it is. I know you mentioned a lot of things about your feelings and how you're still processing things, but like, what was your feeling at the actual moment when you rung the bell?
Why do we ring the bell? Why do we ring the bell? I do not know. I guess it excites other people. But again, I guess, there were people in there to pay. I didn't understand why we ring the bell. And people have said, are you very excited? Did it feel good? And I've told them I can buy you a bell and you can ring it also if that makes you feel better, because I don't.
Well, thank you for being transparent.
You are welcome.
Answer, as always. Thank you. Let's see if we can pull Mr. Juan's video, his story.
So in the middle of June, I was simply swimming in a pool, and I believe in divine intervention. I believe everything happens for a reason. And a small leaf landed right on my chest, and I simply went to pluck it off. And I felt a small lump, if you will. At that time, I didn't think too much of it. I kind of let it go. And I think that would have been a critical mistake had it not been for my amazing wife, who approximately 2 weeks later, she found the lump on my chest and immediately said, we got to go get this checked out. After some test by my doctor, he insisted that I go get a mammogram and an ultrasound. And my reaction was, wait, what? A mammogram? Me? I'm a man, but I listened, as I'm happy I did. Shortly after that, on late July, I got the phone call that really nobody ever wants to get, and it's you are positive for breast cancer. There was a lot of crying with my family, but I also felt their strength because they are my everything. So over the course of the next month, there was approximately 15 doctor's appointments, and I kept feeling more and more empowered because I was learning as much as I could, because I was educating myself and my family and friends and neighborhood. They were behind me. And I knew that I wanted to beat this for them as well as for me. And now I've had a double mastectomy a month ago. And I'm also starting some medicine treatments. It's not fun, but the outcome will be significantly better than what could be. So that's my story in a nutshell.
Yeah.
Okay, so before we move on, Sister Regina has other obligations. So I'll let you have your.
Okay, I just wanted to leave you with a word of encouragement. First of all, I want to say that a good attitude in anything that we're going through is half the battle, if you know what I mean. And so I decided that I would look at things positive, and I'm always encouraging my clients to do the same, and so I did the same. And the children helped. And so when I had breast cancer and my hair began to fall out, they sat me in the middle of the living room and all my children gathered around, and I said, if I'm going to lose my hair, I just as soon have control of it myself. And so they scalped me. And that was a new experience for me because I never saw my head bald headed. And so we laughed and we drove all the way to Oakwood University to get my daughter situated in school. And when we would get out of the city, I would take the wig off and throw it in the back seat, and they would fall out laughing. And we would just laugh all the way to. And I said, nobody knows me here in Oakwood. I can drive ball. We drove there. And we got her settled in, and when we would stop at a light, I would say, give me the wig, quick, quick." And I said, because we're at a stoplight, and I would throw the wig back on, and my husband would look at me and say, "You in something else," and we would laugh, and that's how I made it through the breast cancer. But when I got diagnosed again with this time, I want to say that God was so good to me. He was so good to me when I lost my son. He just held me in his arms and he just carried me through that thing. And before I even got to take chemo and radiation and all these things, he just provided for me. I tell you, faith is a thing that can't be used until there's a problem. If you don't, if you as long as faith is no good when everything is going right. Faith is good when there's everything is going wrong, and that's the time to trust God. And I just trust Him. And my employers provided for me. One family gave me $20,000 and told me to stay home and take care of myself. This is the kind of thing that God does for His children. And I was able to stay home for a whole year and just focus on myself. I didn't ask anybody for anything. Shortly after I started the chemo and we had the funeral of my son, they wanted to give me a 60th birthday party. I said, absolutely not. I'm mourning the loss of your brother. But I kept arguing with them, and they said, Mommy, we're gonna give you this party. We're gonna rent a place. We're gonna give you this party. And then I was so mad at them. And then somebody said to me, they lost their brother too. This is not for you, this is for them. And so I went to the party. Some people here were there, and they just lifted me. I had no time to really, be sad, because the Lord he just swooped in and everything was just holding me up. It wasn't until after a year, after that year passed, that I started to go back and start. I was angry because I wanted to grieve my son. I wanted to be sad, but God didn't want me to be sad. I couldn't understand it. And so after a while, I stopped fighting against it. And I said, to God be the glory. He don't owe us anything. He's given me everything, and if he never does another thing for me, he's done everything for me. If you know what I mean. So I'm grateful for life. I'm grateful to be here. I'm grateful for a measure of health. And I thank God every day for his blessing. And so if I had to give advice to anyone who's going through this, trust God. Everything happens for a reason. But God, he will show himself there. He will be there for you. He will hold you up with wings of eagle. And I'm just so grateful to God. God bless you all and anyone, and God bless you, especially you touch my heart because it's new to you. We're all veterans, me and her, but but it's new to you. But to God be the glory. Just keep lifting him up, and he said he'll be there for us. Encourage someone along the way, and thank God for every experience, even my black hands. I was freaking out. The sister will tell you over there, Sister Jillian will tell you, and I was freaking. I came here. I came to Southwest on Darby, and they were having who was it? The Allegheny, not the Allegheny. What was the church that was having the thing outside here? You what Sherry is a member of. Lansdowne Church was having an event here a year ago, I think, a couple of years ago. I think it was in 2012, and I came and I saw Sherry, and her hands looked like my hands now, huh? Cherry, you will get me. Cherry, I saw Cherry there, and Cherry hands were dark, and I said to my husband, look, her hands is dark. She's going through chemo. She's going through cancer. And so I introduced myself to her, and I told her that I was just got finished going through chemo and radiation. And she said to me, and we started to pray, and we bonded. Cherry. And let me tell you, I came here for the concert the other night. And when I came in, I saw her and I said to her, look, my hands look like yours did then, and yours look like mine. To God be the glory. Everything we're here for a testimony. Tell of his goodness and his grace, regardless to what you're going through, because God is good. He said, if I be lifted up, I would draw all men into you. So I thank God for the experience, good or bad. And I thank God that he uses me in spite of it. So I want to encourage you, hold on. God is able to take us through the storms of life. God bless you.
Thank you so much, Ms. Regina, for sharing your story and giving us those words of encouragement. We're going to shift and ask the panelists a few more questions. We want to start this next question off and give Ms. Nedy the opportunity to answer first, and then we will allow Sister Blackwell and then to answer.
What's the question? I didn't hear the question. I don't know if you all can hear me, but I didn't hear the question. Hello?
Hi, Miss Nedy, can you hear me?
Yeah.
The question is, what advice can you give someone who was recently diagnosed?
Um, I think the question is it, what would I give someone who's recently diagnosed with cancer? Is that the question?
Yes, it is.
Okay. I would, let me think about this for a minute. I would tell them to hold on to their faith and make sure they have people around them. And, I think all of us probably felt at one time or another that, we were superwoman. We had that cape on and that we could do everything by ourselves. But this isn't something you can go through or should go through, me put it that way, should go through alone, because it's a long journey. And especially if, just I think about the number of doctor's appointments I had, the number of tests that I took, all of the chemo, all of the radiation, everything, you're talking about just through treatment alone, a year and a half of just almost constantly, daily, not weekly, something's going on, that you need someone there with you as, someone that's going to be your support system, your sounding board. And like the other sister said, be specific when you ask for what you need. The mothers of the church kept making food for me, and I had a very tough time with chemo, and so I was being infused daily. I wore a backpack with a feeding tube because I didn't eat at all, and I loved them dearly, and I told them, stop making food for me, feed me once I'm done with everything, because I just wasn't eating. And so I told everyone, bring me paper supplies, because that's what I needed. I needed tissues and toilet paper and paper towel. And, I think when you're specific with people, you need your house clean, or you need someone to run errands or whatever. That's what's important. Be specific about what you need. Reach out to that support group, whether it be your church or your friends or family, or whoever it is, and to just don't give up. Just keep the fight. I live by a motto that I heard many years ago about don't give up, don't ever give up. And I think, especially our race, we've been, we're, especially now, we're in a fight for our lives every day, and we are always constantly fighting. And I think we just have to keep that fighting spirit. And all that fight is just a test to see how we're going to make it to the end. I was blessed to have great doctors and who cared about me. And so if you're not feeling comfortable with your team of doctors, get someone who you can feel comfortable with. These are the people who really have your life in their hands. So be your own advocate. Someone mentioned that already, but I guess I would just say, hold on, keep the faith, ask for help, and just continue to know that you're worth saving, you're worth being here. The Lord has you here for a purpose, and that, just continue to keep going forward. Thank you.
Thank you, Ms. Nedy. We will now turn it over to Sister Blackwell and Ms. Aisha to answer.
As I said, for me, my experience was I went into denial. If I were talking to somebody right now, I think the first thing I would say is to breathe. Because cancer kind of hits you like a truck. It's not a subtle hit. It's not a slow motion hit. It's a hit. And your mind goes in all kinds of places. And one of the things that I found is that we don't do enough research on our own. We tend to walk into a doctor's office and kind of just give them carte blanche to do what they think should be done. But we should be able to make a decision after we have educated ourselves. The Cancer Society has a website. There are other places that you can. And one of the parts that's wonderful about knowing other people who have had cancer is you get to talk to them about their journey. And you get to talk to them about how they went through. Because I think once you are more educated and you start recognizing it's your body that you're talking about, you should make the decision that's best for you and not best what everybody else thinks is for you, but to breathe first, because breathing gives you that part of living, because you're taking in, taking out, and then say, okay, when I sit down to talk about the next step or the options, don't let me be led, but let me lead the conversation. Let me ask the important questions. Because once I can do that, then to me, you're more in control of the next steps versus feeling helpless and out of control that somebody else is doing it.
The advice that I would give would probably be for everybody, actually, not even just someone diagnosed with cancer. One of the things that rung to me the loudest, that flashed before, I guess, through my mind, was all the things I had put off, all the things I was waiting to do, all the things I said I'm going to get around to it, or when I get to this point, I'll do it, or when I save this much money, or when I work this much, or that vacation, the trip. One of the things I did after my first biopsy, I went and bought a car. I went and traded my car, and right up from the biopsy, I went to the dealership. Because I've been wanting, I told myself I wanted a truck, but for some reason, we sometimes deny ourselves. We're so used to taking care of others. Because if this was someone else in my family, I could be there for them. But being there for myself, showing up for myself, was different. Um, don't put off those things. Um, the good silverware, the chair that nobody sits on is only for company. Who decided that? That all the things we work hard for, we put to the side and we never enjoyed ourselves. Because when you're gone, somebody's going to enjoy it, and they will not wait, and they're going to use the good china, they're going to use the good silverware, they're going to sit on that white couch and that living room set and those pictures and those clothes. Don't wait to wear the dress. Don't wait for the special event. Um, I will put a dress on for something simple just because I wanted to. If you wait for something, it may never come. And then all you'll have is just all these things that you just never got to do, but you wanted to. The place you wanted to go, the dinner. Like sometimes you don't want to cook. It doesn't matter if they say you want to go to the restaurant, go to the restaurant and let the waiter wait on you. Because I did that a lot. Like sometimes I don't want to cook. I didn't want to go to the market. My children are grown. The shoes. Don't wait for the sale. Buy them. I'm not telling you to go into debt. That's not what I'm saying. But sometimes we are so used to sacrificing and denying ourselves. And who told us that we don't deserve it? And all of a sudden, when I look back over my past year, and it was like the things that I had wasted, um, whether it was being upset about something or stressed about something or worried about something, or maybe a relationship that was upsetting you. And all of a sudden, if you go to the doctor and the doctor tells you that you only have this amount of time left, none of that will matter. The arguments will not matter. And I know that you've heard it, but when I say that I felt it and I live that every day, some stuff, it just doesn't matter. Who likes you? Who doesn't like you? Who doesn't approve? Who does approve? Who made these rules? If I want to wear white in December, I'm going to wear it, whether it's Labor Day or not. I'm going to do it. When people tell you can't, this is those rules. I don't know who made them. This is your journey. That is my best. So if you want to wake up and you feel like I want to go and just do this, if I want to take a nap, sometimes I felt I had to earn a nap. I had to earn taking a day off. Who told me that you had to just work so hard or you had to accomplish? Some days I'm not productive. Some days there is laundry, and I wake up in the morning and I am guessing, looking for something to put together because I did not do the laundry like I should have, because I did something else. I took a nap. I slept. I watched Netflix. I had a conversation. You will not be able to do it. You cannot get that time back. And a sense of humor is very, very helpful. So that would be the best advice. It's your journey, it's your life. So do not deny yourself. And as she said, I had really good doctors. Talk to your doctors. Do your research before. And then I'm a little obsessed about that. So I watched so many. I even made the mistake of looking at a surgery. That wasn't the best thing to do before. But some stuff, educate yourself, ask questions, have someone slow down. I've had to ask a doctor that I did not want to work with anymore. And probably in the past, I would not have done that. I didn't feel comfortable. And I was okay. Speak up for yourself. Be unapologetic because it is your journey. That's my best advice.
Thank you so much for saying that. Definitely to your point, it's really important to advocate for yourself, especially when you're getting treatment in the healthcare system. That is so important. So we should all try to speak up for ourselves and to be informed enough when we have these discussions with our physicians. We want to close this section off with the video from Mr. Juan. He has a message for us and something he wants to share about breast cancer awareness.
What do you want people to take away from your experience with breast cancer?
First of all, if you find out you've recently been diagnosed with cancer, don't go on the internet and start reading all the articles. Some of them get really insane. Some of them are way traumatic. Talk to your doctors first and find out exactly what needs to be done. What I want people to walk away from my experience is that you're never alone. However dark things may get, however challenging the process.
What message would you like to provide to people in the community? What do you want people to take away from your experience with breast cancer?
First of all, if you find out you've recently been diagnosed with cancer, don't go on the internet and start reading all the articles. Some of them get really insane. Some of them are way traumatic. Talk to your doctors first and find out exactly what needs to be done. What I want people to walk away from my experience is that you're never alone. However dark things may get, however challenging the process is, and it has been to lose, a double mastectomy and be dealing with feeling really bad during the days with my medicine. It could be worse. It could be worse. We have people around us that love us. We have people around us that are willing to bless us with their time, energy, and effort. So what I want you to walk away with from my experience is that I've learned to be humble and accepting help and allowing people to come into my life that are willing to help me. And that's been the biggest blessing of this whole thing.
What message would you like to provide to people in the community?
That's a great question.
And then we have a second video as well from Mr. Juan. It's his final video.
What message would you like to provide to people in the community?
That's a great question. When this all happened to me, I've realized one thing. Breast cancer is not just for women. The main message that I'd love to spread, which
You can continue to play.
I'm going to make it my mission, is that this affects men, not as much, but it does affect men. And unfortunately, it does feel a little isolating when this whole month is all about pink. I would love to start sharing awareness that there are men that suffer from breast cancer that need the same spiritual and emotional support aside from the physical medicinal support. So the community should be aware of perhaps incorporating a little blue in some of the ribbons, or just calling it Breast Cancer Awareness Month, not Women's Breast Cancer Awareness Month. I've learned in a lot of my doctor's appointments, it's been a challenge emotionally for me because in every doctor's office that I've gone into, it's been the women's center. Women nurses are very sweet, and they're in awe when they say, "Oh, you're my first male patient." And while I understand that they're eager to learn, it kind of singles me out. So I think as a whole community, as a whole society, we need to start embracing the fact that this affects men and women, and we should make it okay for men to reach out for help and not have a stigma where, oh, this is only for women. What's wrong with me? Cancer has no audience. Cancer has no vision. It just attacks anybody and anything. So I hope that we start embracing the fact that this is pink and blue. Men need help too. And we should be ready to lend a hand anytime we can.
Dr. Elmore back as well. If anyone has any questions they would like to ask her or the panelists in person, if you have any questions for Miss Nedy, we would like to ask her those questions first, as she has to leave shortly, but we do want to include her in the Q&A. So we will open the floor to the audience. We'll have Dr. Elmore answer this question. And the question was, why do they have to wait until the age of 40 to screen for breast cancer?
Yeah, that's a great question. And so again, starting at age 40 is for women that are average risk for breast cancer. And so some women may meet criteria to be screened at an earlier age. But we know that because of breast density and the lower likelihood of being diagnosed before age 40, that routine screening mammogram, in average risk women, detects more sort of false positives, if you will, that lead to biopsies that aren't cancer. And so that's why the recommendation is to start at age 40. But again, that's not a one size fit all recommendation. And so that's why we recommend risk assessment by a doctor, because, you may need to start before age 40.
Thank you, Dr. Elmore. Is there any other questions, Sister J? This is another question for Dr. This is another question for Dr. Elmore. The question is the 3D testing the most efficient way to detect breast cancer?
Yes, so 3D mammogram is the standard of care now. So if you are going to a place that is offering you anything other than 3D mammogram, you should run, because they are outdated. And so that is the standard of care. We have a better window in the breast through 3D mammogram, also known as tomosynthesis. And so, yes, that is the recommended screening protocol. And any place that you go to get a mammogram should have that technology.
Thank you, Dr. Elmore. We have another question. Another question for Dr. Elmore is, for women who have dense breasts, should they get a second opinion when they can't find anything on the mammogram?
So I think there's a little more nuance to that question. So if you are feeling something in your breast and they don't see anything on your screening mammogram, you need a diagnostic mammogram and an ultrasound. So mammogram is hindered by breast density, ultrasound is not. And you may need an MRI to get a better look into your breast. So if you're feeling something and they don't see it on mammogram, you absolutely need additional testing. If you have dense breast on your mammogram, then that's something you should discuss with your doctor, because you may be recommended to undergo MRI as a part of your screening protocol as well. So for women, if your mammogram says extremely dense breast, then it's worthwhile talking to your doctor about whether you should receive MRI in addition to mammogram.
Thank you. We're going to actually start with Miss Nedy and then Miss Aisha and Miss Blackwell. The question, Miss Nedy, was, do you have any, or what's your experience post breast cancer?
My experience post breast cancer.
Yeah.
Well, like I said, it's been 14 years, and physically, I feel fine as far as, that's concerned. I've, you deal with things. They took a third of my breast because I had a lumpectomy. So I wear like a little prosthesis, little insert in there just to kind of smooth things out. And I've had about 3 years after my treatment was over, 3 or 4 years, I had a reduction on the left side just so that I wouldn't be, uneven as much. But so as far as that's concerned, I haven't had any problems there. All of my tests have been good. I only see my oncologist once a year now. I don't take breast MRIs anymore, which is good if anyone's ever had an MRI, but just think about doing it face down. Um, I did that for quite a few years. So I feel like I'm on a good path as far as the breast cancer, but I don't think about it. We know that it can come back at any time, or it won't, but I don't let it rule my life by no means. I try to carry on with my life. I just had my mammogram, as a matter of fact, last week, and I got a good report, and then I just move on. So I just try to live in the moment, live every day. I just turned 65 this summer, and I'm just looking forward to the rest of my life, and just trying to make it to be a blessed, joyous one.
Thank you, Miss Nedy. We're going to have Miss Aisha and Sister Blackwell answer that question as well.
Post-op, how to get back. Well, you're not the same. Well, for myself, everything about you changes. The way you see things. Cancer is disrespectful. Um, it does not respect who you are, what you represent, where you work, what your title is, how much money is in your account. Uh, when you get dressed in the morning, you have these imperfections that nobody else sees but yourself, and you whether you layer it or you put a jacket over it or you wear something a little longer, whether it's your stomach, all of that goes out the window when all of a sudden I have been exposed to so many people that I do not know. I've had students come in. I've had comments. I had to laugh after a while. Then want to have conversations as if my breast is not out in the room and there's people that I do not know. They take pictures. So life after getting back to it, everything changes. But I honestly must say I am happier if that makes sense. I look at life differently, if that makes sense. If it doesn't sound like the end of some type of happy movie, but there's this joy. And it's not just as simple as I'm still alive. It's just that I was able to see things differently. And I've experienced people differently. I love differently. I've felt love differently. Um, and everything is just stuff that seemed big is small. Some stuff that was small is much bigger to me now. So I'm still learning. I think, and I just keep looking forward to it. So
Well, I'm a little further out. But for me, it was 2 years later and having to do it all over again, which meant that they removed more. And um, it took me to a place where I didn't like my breasts anymore because they were no longer the same size. There was an extreme difference in not just the way they looked, but the size um, of how they looked. And so, what, 15, 16 years ago, I finally said to my doctor, I can't do it anymore. I don't even try a top on. I go into the store and I pick it up and buy it because I don't like the way they look. And so I had surgery, cosmetic surgery, and it was funny because my surgeon said, "Do you have a size that you want?" And I said, "I want you to take them as small as you can get them, but I need them to stand up and look at people because they haven't seen people in a while. They've been looking down, and there's nobody down there." And so he did a great job. And it was funny because I was bandaged up. And so when he came into the room and he said, "Well, everything is swollen," he's giving me all this information. I looked down and I partly cried and I got so excited. And he said, "Why?" I said, "Because I've changed. I'm different." And that kind of moved me toward a different feel about myself. Even though after I had the genetic test, and recognized that cancer was still sitting out there for me, I haven't let it have a place where it ruled and decided how I would manage. Now, as I said, I'm almost 30 years away, and I get up every day, and I'm grateful. Um, I, I I have not fallen off on the mammograms because I just had one. It was funny because I had my first scare in 30 years. They found something on it, told me I had to come back. So I remember sitting in the car in the parking lot and I kept saying, "Okay, we're not going to borrow from anything until we know what we're looking at." And my niece was still going through hers. And so I said, "Okay, we're not going to borrow. We're not going to borrow." So instead of praying for the Lord to do something, I just gave thanksgiving. And I just told the Lord how grateful I was to Him for what He's done for me. And so the pathologist was there. And so they took, I don't know how many pictures. And so finally he said, um, I forgot what he called it, but it made me remember a few months before I had been vacuuming my house and I injured myself with the handle. And that showed up on the picture that it had bruised on the inside. And there's a name for it. And so they had to be sure that's what it was versus what it wasn't. So even though I still have to go back 6 months earlier, just to be sure, we put the puzzle together from that. And I was going out of the building and I said, look at you, God. You are amazing. And I'm grateful because no matter what it had been, I made almost 30 years out. And if you're talking to people who are not surviving, but who are getting through, every day is a good day because you're walking, you're talking, and you're able to be with the people you love. So, I mean, I can tell you is that it's been a journey. I'm grateful. I don't know what tomorrow holds. I know they say that I could get cancer, but I could also be hit by a bus. I could, close my eyes and go to sleep, and cancer won't have time to talk to me. So rather than worry about it, I just live. And that's something that I'm learning. Don't just live, but live. Because we spend a lot of time just surviving and living. We should be really living. And that's the motto I have, is to live.
Thank you, Sister Blackwell. We have our last final question from Sister J. And the last question goes to Dr. Elmore. And the question is there an age where you don't have to worry about getting any mammograms?
That's a great question. So there's not a catch-all age where we recommend stopping mammograms. That's another thing that's highly individualized. If you have, multiple medical issues, and those outweigh, the likelihood of a breast cancer diagnosis, and in terms of your longevity, then typically we'll recommend stopping mammogram. But that's another one that is a nuanced discussion with a doctor. We don't have a single age where we say, hey, you should stop, because we know that the likelihood of breast cancer continues to increase, as you live your life.
Thank you, Dr. Elmore. And then, okay, a final last question. This question is for Dr. Elmore. The last question is, what is the ratio between white and black men with breast cancer, and what's the likelihood between the two? Who has the higher likelihood of getting cancer?
So, we know that male breast cancer represents only 1% of all breast cancer. And so it's more likely to occur in white men, but even still, black men are more likely to die from breast cancer. And so, I don't know if that answers your question more specific, or if you're looking for a more specific answer.
Thank you. Thank you, Dr. Elmore. We do have some breast cancer resources that we curated just to share with you all. If you are in the state of Pennsylvania and you might be underinsured, oh, I'm sorry, we have a follow-up question. Oh, a question for Dr. Elmore, based on your answer, is why is it that Black men are more likely to die from cancer?
That is the topic. I mean, it's similar for Black women. So we know that Black women are more likely to die from breast cancer compared to white women. We know that that's multifactorial. We know that there are certain types of breast cancer that typically present in African Americans, particularly, triple negative breast cancer, which is more aggressive. We know that, typically will present at a later stage. So there's a lot of reasons. There's not a single reason. And I could almost give you a whole talk on all those reasons. We also know that there's some data that, treatment is not equitable. So, a white woman or a white man and a Black woman or a Black man may not receive the same treatment for the same diagnosis. And so, infuriating and sorry, it's the subject of something that particularly interests me, and it's the subject of a lot of our work to try to move the needle and make sure that we have equitable outcomes and make sure that we are living as long as possible, and not suffering and not getting subpar or inadequate treatment.
Thank you so much, Dr. Elmore. We did create some resources to share. Dr. Elmore stated earlier that if you are someone who is interested or you know someone that needs to get a mammogram or needs further breast cancer treatment, we are able to connect you with her, but we also have the Department of Health that offers a breast and cervical cancer early detection program, as well as a treatment program through the Department of Human Services. And Penn Medicine also provides a a breast health initiative. So if you are someone who needs a mammogram or individual who just wants to seek out more information, these resources are provided here in the state for you.
All right, let's give an applause to our panelists and Dr. Elmore. Seriously. We would like to say thank you so much for sharing your story with us. To those online, Ms. Nedy, Dr. Elmore, thank you for your time. And Mr. Juan, thank you for being here and just giving us more like an inside scoop on what it's like to go through the situation and what gave you the strength and how to keep on going. And thank you all again for being so transparent with everything. So we appreciate your time and everything. So because of that, we would like to give you a small token of appreciation for your time and just being here to share your story. And for our Mr. Juan, Dr. Elmore, and Ms. Nedy, we also have something for you. You get it in the mail. And Southwest family, thank you all for coming here and showing support to the health ministry. We appreciate each one of you. We do have a few upcoming events just to let you all know. If you're part of the walk-in group, we are meeting next Sunday at 10 a.m. in Kenwood Trail for those who want to walk again, the last walk. And then our award ceremony is the following Saturday, November 12th at 4 p.m. So we hope for you all to be here. And oh, how can I forget this? We have refreshments for you all downstairs. So look at that, refreshments downstairs. And now we are going to ask our Pastor Blackwell for a closing prayer, please.
All righty. Thank you so very much, family. Thank you, health ministry. And now y'all understand why I'm the one that have to vacuum in the house. Amen. Yeah, she keeps me busy. Amen. Let's stand for prayer because all of us need to stand. Amen. Father God, we just thank you for the presentation, the opportunity to hear the individuals give their story as well as help us and to understand how to approach other individuals or one another when they are dealing with cancer. Thank you for the education as well as the information. Now bless, give us what we need for the remainder of this evening and into this new day. And we thank you for safe traveling mercies as well. In Jesus' name, amen.
Before I forget, special shout out to AB. Thank you all for your help. Ashley, your help behind the scene. And Austin, thank you for your help. Roderick, thank you for your help. And Marcus, thank you for your help. We could not have done this without all of you. So thank you for your help.